My name is Stella Kentusi, the Executive Director of the National Forum of People Living with HIV and AIDS Networks in Uganda, Nafofano, one of the authors of the study that appears in AIDS behavior. Thank you for the invitation to present findings from the study to understand what shapes resilience among people living with HIV. As part of background information, resilience can be defined as a positive adaptation in the face of significant adversity and is intimately linked with improved quality of life and health outcomes among people living with HIV. This includes via facilitating uptake of and adherence to antiretroviral therapy. Therefore, understanding factors that lead to resilience is critical to inform programming and policy. And in this particular study, we examine the influence of multi-level factors on resilience in 3 countries. And the data that we have and is being presented is from the People Living with HIV Stigma Index 2.0, a widely used tool survey implemented by, for, and with people living with HIV to track stigma and discrimination nationwide. Regarding methodology, the sample included 1,207 people living with HIV from Cambodia, 891 respondents from Dominican Republic, and 391 respondents from Uganda. The participants came from 6 provinces or districts in each country, and this was to capture a diverse group of people living with HIV, that the participants or the respondents were sampled purposively through venue-based and snowboarding sampling. We measured resilience with a newly developed people living with HIV resilience scale, which asks whether HIV status has had a negative, neutral, or positive effect on respondents' attainment of needs in the last 12 months, such as ability to cope with stress, find love, or contribute to one's community. The score for this scale ranges from -10 to +10. And for more information on this scale, you can look at the article at the bottom of this slide in AIDS behavior. The respondents from Cambodia, Dominican Republic, and Uganda were 60% female, 40% male. The proportion who were a member of a key population varied by country based in part on the sampling methodology. The mean time since diagnosis was 11 years in Cambodia, while it was 7 years for the Dominican Republic and Uganda. And at least 95% of the respondents in each country were on ART and in the process rated their life as good. Regarding results, we found that respondents reported substantial but varying levels of resilience. You can see in the figure that there was a variation both across the 3 countries and between the 6 provinces or districts within each country. The study based on a conceptual model. This is a model of the types of factors we focused on at each level, and the levels we considered was individual, interpersonal, and structural, and we'll go through findings at each level in turn. The first level, which is associations with resilience at individual level, in multiple regression analysis at the individual level, the most important factors associated with greater resilience were lower internalized stigma, and this was true in all 3 countries. And no experience of human rights abuses in the Dominican Republic and Uganda. Additional details are available in the table. Associations with resilience at interpersonal level. At that particular level, an important factor was less HIV-related stigma from close family members. And the final level, which is association with resilience at structural policy level, important factors included greater community level awareness of legal protections for people living with HIV and the experience of HIV-related stigma. From the study, we derive a number of conclusions. For instance, we found that factors at multiple levels affect whether people living with HIV in these countries report resilience. We also concluded that internalized stigma and awareness of legal protections for people living with HIV were particularly important. In addition, our findings suggest that to promote resilience, multi-level interventions are required. And findings also suggest that future research should continue to explore reasons for variation in resilience within and across the country. And for more details about the analysis just presented, please see our recently published paper in the journal AIDS. I would like to thank the people living with HIV Stigma Index 2.0 respondents, as well as interviewers in each country. We also thank the study group in each country, and that was Uganda, Cambodia, and Dominican Republic. Thank you very much for your attention, and we look forward to answering any questions that you have during the panel.